Hi, my name is Matt Glotterman. I'm one of the doctors working with CHOC, the out-of-hour service, and I also do some work in Upper Eden at the moment. I'm trying to introduce a electronic kardex and a way to change palliative prescribing throughout the entire region of Cumbria. Appreciate you clicking on the link. If you're in agreement after this short video, shouldn't take more than 10 minutes, please send me some information back just to say that you'd be supportive of it. Essentially what I'm trying to do is replace the paper palliative prescribing charts with something that's electronic. It will be more efficient, should be safer for patients, and I think if you're talking about that in the NHS, it's a win-win for everybody. So yeah, please let me know what you think. If there's any concerns or questions, I'm happy to answer them. Thank you.
Right, so I apologize, it's a bit of a crude video. I'm trying to kind of do this, but this is kind of an intro to what we could be using in Cumbria, what they are using in Sunderland, developed by Andy Richardson, who's one of the GPs out there. So we're trying to standardize palliative prescribing and make it a little bit more efficient, a little bit easier. So these are electronic cardexes that we could easily get for free and have them amended specifically for Cumbria. So there's a number of different cardexes. This is just what I have access to. So we've got anticipatory cardexes and driver cardexes, as well as a renal kardex. So anytime you're opening them, you can just do an anticipatory renal kardex. Patient's information from EMIS will populate through. Obviously this is a test patient, so there's no patient information details. All the details pull through on the kardex. If you're signed in with EMIS, your electronic signature comes in here. If you're a second prescriber, it won't automatically come in, but you can fill it in here, so you can populate this free text-wise. Allergies will pull in automatically as well. So this is an important section that isn't on our current prescription charts either, which I find much safer for patients, which is thinking about medications at the end of life and palliative prescribing, like fentanyl patches, buprenorphine patches, insulin, dexamethasone. We can tailor this prescribing sheet to look how we want it here in Cumbria for free. So with regards to just in case medication, it's got alfentanil already pre-populated for people with renal impairment. So that's the kind of just in case medication. Obviously alfentanil isn't used readily in the community here. It should be used if someone's getting started on a driver, but this is kind of how their kardex is already pre-populated, so you're just saving these doses. If you need to amend them or change them, you can do that. And there's like haloperidol instead of cyclazine, things like that. They use hyacinth butyrbromide, but we can change it to glyco or hyacinth butyrbromide. And then these are other medications you could consider kind of writing up subcut. I'll just close this one up and then just show you another one. So we'll go to the regular anticipatory kardex. Again. So again, populated here, your name will come off into there automatically. So an electronic signature as opposed to a wet signature. Allergies should come into it automatically as well. For this one, there's a drop-down menu, so if you want, so this is a non-renal kardex, so morphine or oxycodone. If you click morphine, then you can choose the dose, kind of starting doses. So 2.5 to 5 milligrams, 1 hourly, and then that can be amended if you want to. This is for breathlessness, so this would be for pain, breathlessness, agitation, already pre-populated. If you're wanting cyclazine metoclopramide, for us, as I say, we use Levo here quite a bit, more than Sunderland would, so we probably put that in the pre-populated area. And then if you click on cyclazine, it automatically gives you the kind of pre-populated dosing range. Again, hyacinbutylbromide, we'll probably have both hyacinbutylbromide or glyco as an option. And then, yeah, extra medication if you want to. Now, when you save it, you kind of go in, save and close the first time. And what also happens is it will automatically ask you to populate those medications in EMIS. So there's like an automatic link. So you'll be able to prescribe them on the medication section, which will be pre-populated from the kardex. So it's a lot faster, more efficient. And the district nurses will have access to this, so it'll be easy for them because they can have a look on EMIS, print this electronic kardex off, and have that in the patient's home when they're going there, as opposed to worrying if it's there or if it's not. And if there's any amendments or changes needing to be done, then let's say I save this consultation and I want to go back and change it. So you go in here, edit the consultation, go into this kardex again, and instead of, let's say I'll change it from morphine to oxycodone, and I'm going to use 2.5 milligrams, and then I'm going to go to file, and instead of save and close, pick save as. Because it's the same date, it's not going to show, but let's say I save it for yesterday because you can't go forward. So then I save that kardex, and then the most up-to-date, accurate kardex will be on the patient system going forward. So then you file and close that. And then if you go into documents and you need the most up-to-date kardex, I've done a few obviously today, but if you're looking at anticipated prescribing, this will be from yesterday, the 2nd, and that's where the oxycodone will be. And so your most up-to-date version of the prescription can be saved onto the record. So if, you know, on the October 4th we need to change anything on the kardex, that can be done. There's also syringe driver kardexes, so if I go back into here and show you that one briefly. So again, this is wildly more efficient than what we're doing now. It's an electronic signature as opposed to the wet signatures that we're using. It's got more safety features built in, and on top of that we can add extra things into this. If we want to have numbers for the out-of-hours palliative care or in-hours palliative care contacts, we can put that on there, specifically for Cumbria. So yeah, again, safety medication that they should be prescribed. This is the as required medication, so all of it's on the same sheet. Further as required medication, and here's the driver, and there's drop down options. So if I want to do morphine for pain and breathlessness, subcut, and then you're choosing, so there's options for what you can mix with. So that gives you some added safety elements in there as well. And again, you're kind of writing in doses and putting in what you need to do. So it will save everything automatically when you save it. And if you need to amend things, you can put dates and times. So hopefully this will be something we can introduce as soon as everybody signs up and is on board with it, and it can be amended, specifically liaising with Andy Richardson, myself, and the kind of palliative teams involved, as well as getting the district nurses on board. So I'm hoping this will be a worthwhile new feature we can add. Obviously, if you have any questions, I'd be happy to answer them, but yeah, hopefully this video has convinced you that this would be a good idea to introduce into Cumbria, and we'll go from there. Take care.